Hi guys. Yeah, it's been 3 years since I made a video. So, I just want to update you guys. I want to apologize for never really making the video after I got my braces off. I don't know why I didn't. I'm really don't know. I'm sorry. But I wanted to come back on here because if you can't tell, I have braces on again. And there's a lot that's like going to be happening. So I just kind of wanted to talk a little bit about, some of the updates that have happened, what happened after I got my braces off, and then why I have them on again. So basically I got my braces off like right after I made that video. Sorry for my voice. I actually have COVID right now, so cool. But yeah, so not to mention my voice is just always like this, and yeah, so yeah, after I got my braces off, everything was cool. I wore my retainers every single day, but at one point it really started to occur to me that my whole life I have always wondered why my face looked different and why I always was unable to close my mouth properly and comfortably. And I started to notice that the more I tried to just close my mouth like how normal people do, why eventually my jaw would start to get tired. And I kind of regret never having thought of that before, or my orthodontist never mentioning my jaw before, but he just never did, and I never did. It's one of those things that I think like you don't think about until you think about it, and then it all kind of clicks and makes sense. So my whole life I've never, like I was saying, I never was able to really close my mouth properly. I always had just like a weird tension, but I always just thought whatever. My dad has a similar jaw to mine, and me and my sister inherited that from him, or at least it seems like we did. I definitely did. And along with this also came the upper palate being caved in, which I did have taken care of back when I had my braces. I did have my palatal expander before I had my braces on, but that's the extent of what I've done outside of braces. So at the beginning of 2021, literally like I made it a thing that I wanted to figure out what was going on. So I called my orthodontist, and we kind of had like another consultation to get a reference to a jaw surgeon. Excuse me. And so he referred me over to someone close by me who is, good surgeon, been doing this for years. My orthodontist was telling me that if I, just purely cosmetic reasons, he didn't see, he's not a surgeon, so he wouldn't be able to tell me the reason, but he was able to tell me that when I smile, because I have so much gums, that it appears that my whole jaw is like too far down, and that if you move the upper jaw up, the bottom jaw will go up with it, and then it'll look more normal. So that's just what he was saying. So I went to the surgeon at the beginning of last year, and yeah, pretty much he said the same thing. He also was doing like a few like pressure tests or whatever, where he just like, have me open my jaw when he was touching certain areas. And there was one point where he touched and I opened my jaw and it hurt so bad, which kind of confirmed to him that I totally don't remember. It's been a whole freaking year, but something in here is like not developed properly, and that causes like clicking. It didn't form properly, and that causes the way it looks. I mean, I don't want to call it a deformity, but my whole life I've always been insecure about it. It causes clicking when I open my jaw. I have the excess gingiva, or whatever they call it, gums up here when I smile. And then just the tension in general from not being able to close my mouth properly or comfortably. My teeth do line up, so that's cool. But it's like there's just too much. I don't really know. I don't know the technical terms, except I do have what he diagnosed me with. which was maxillary hyperplasia, mandibular hypoplasia, and microgenia. I do know the microgenia is like the too small or undeveloped chin, which he said it's very mild, and if we did do the surgery with the chin, it would kind of just be up to me. I don't think I'm gonna do that because of the way my jaw has looked my whole life. I've always had this idea that it was actually my chin that was oversized. So to have a smaller chin, I think I'd be cool with. But anyway, that's pretty much what it was. At the time, I didn't have insurance, and I got on like kind of like a free, not government, but like from Michigan where I live. Somehow I was approved. I really don't know how. But getting approved for the surgery itself took months and months and months. I kept getting denied, even though my surgeon said that most people never get denied for this kind of thing. It's actually really weird. He wrote a appeal letter, it got denied. He wrote another appeal letter, it got denied. And this was like, it had been like August at this point, from January of trying to fight this, because they would just take months to get back with me. And finally I wrote an appeal, and it turns out the whole time they literally were just denying me because they didn't have photos. And so I was like, because in the message I was like, please, like, let me know if you need anything. And it turns out they just needed to contact my orthodontist to get my x-rays or something. So my orthodontist sent that over. I was going to have a hearing, and it was like this whole thing. I have videos. Sorry, I can't see. I have videos of all of that at some point I can upload, just me being emotional and everything. So eventually, the day of my hearing that I was supposed to do like over the phone, I'd like hear all these doctors and people, discussing my case. And then the lady called me and she said, actually, you don't have to have a hearing. A doctor looked it over and just immediately approved you. Sorry for all this. So luckily, finally, I got approved in like late last year. So it was a process. This whole time, I didn't even get my braces back on. Sorry for not just explaining that. You need braces in order to get jaw surgery, so that when they do the surgery, they can hook like things to it to keep your jaw in place. So I don't need braces because my teeth got crooked again, even though they did shift, which is shocking because I always wore my retainer. They didn't really shift that much. They did a little bit, so having the braces back on was like cool. But I just needed to have them on. But I didn't get them put on. This whole point of me waiting to get approved, because I didn't want to commit to thousands of dollars for braces and then not get approved for a $30,000 surgery that I can obviously not afford on my own, and you have to pay it all up front. So there's not even a payment plan. So I'm like, yeah, don't have that. Sorry. But yeah. So I eventually got approved. I got my braces back on in like the fall, and then I was only approved till like December. And I was like, how do you people expect me to do all this? Because my orthodontist was telling me that my teeth can't be shifting during the time of the surgery. And so they needed to work up from like a thin wire to the thickest surgical wire, which could take a few months. So I was like, dang it. Are we going to be able to do this by December? And I mean, December 2021. And he was like, yeah, I don't know, probably not. But then I ended up getting to the surgical wire by December. But then the surgeon had to see me and we had to make the appointment. So basically, I'm not getting the surgery until April. Everyone got pushed back because of like COVID and tons of shit. So I'm not getting it till April. So I'm just really hoping. They said that they could extend my insurance, but my insurance is month to month, so I could literally get canceled at any minute. So that totally sucks. I'm a little bit nervous about it. So yeah, that's what's going on with me. I really want to keep posting on this channel. Sorry, I was babbling. I was trying to not make this video too long because I want to like keep making updates and everything where I explain more as to like what's going on, but that's just a very brief description I can do other videos of whatever you guys want to see. If you have any questions, I definitely want to talk more about my jaw, show you x-rays and things like that. But for now, that's what's been going on. A lot has changed in my personal life. A lot has gone on in 3 years. So, yeah. But yeah, so that's what's going on. If you guys have any other questions, like I said, just leave them in the comments. If you still remember who I am, if you were an OG from 3 years ago, comment and let me know. But yeah, I think I touched on everything. And I will be making updates as to, leading up to the surgery, some basics surgery preparations. I can talk more about my issue with the insurance because that was such a pain in the ass. I can't even tell you. I want to talk more about what I'm doing to prepare, how I'm nervous, and then I want to make like vlogs of when it does happen. Of course, I really want to document that because I think it's really important. I also think that getting the surgery might help my voice. I don't know if you guys remember, but I've always had like tension in my vocal cords, and I've always talked like mumbled, or it's hard to get the words out. And I have no idea if that's connected, but I saw a video of a girl who had jaw surgery who was a singer, and she mentioned that her voice did get better. Not like, sounded better like in that sense, but easier to speak. So we'll see. I have no idea. I have my main appointment to just kind of like my pre-op appointment 1 month beforehand, so I will have that in March, and then he will show me like what it will look like, just like a basic rundown of exactly what he's gonna do and everything. I'm getting upper and lower and wisdom teeth removal, so 3-in-1, big time attack on my face. We're hoping not to die here. I am a little bit nervous, but yeah, I'll keep you updated. Bye.